The traditional pathway for treatment of prostate cancer was a radical retropubic prostatectomy, or RRP, followed by adjuvant radiation therapy for positive margins, followed by androgen deprivation therapy in the form of an orchiectomy. Because orchiectomy was the only option, this was typically only a salvage strategy. An exception to this pathway was if someone used radiation therapy as their main therapy, if they were not a surgical candidate. Our only recourse after utilizing the initial triple threat was to refer to medical oncology for chemotherapy. Now, several options exist. The triple threat is still very real, with surgery and radiation therapy being definitive treatment, and androgen deprivation therapy being used as a main therapy or adjuvant therapy. For a full list of options, please visit nccn.org. Nowadays, typically someone will go through a robot-assisted laparoscopic prostatectomy using a device known as Da Vinci. Then, they may have adjuvant radiation therapy if margins are positive, and perhaps even adjuvant ADT if they have a higher risk cancer. In order to provide treatment as soon as possible to more aggressive cancers, ADT may even be administered prior to deciding on whether to proceed with surgery or radiation therapy. In this case, it is technically called neoadjuvant therapy. ADT can be used as the main therapy. If this is the case, it can be combined with different androgen receptor therapies for a multi-attack suppression, such as Eligard and Xtandi or Zytiga, or even Erleada. There are several types of radiation therapy. If radiation therapy is being used for positive margins, intensity modulated radiation therapy is the type that is used. This is the most common type. Another external beam radiation therapy is CyberKnife, which is higher intensity treatment. Brachytherapy, brachy for short, also known as gold seed therapy, is installed directly into the prostate in a simple office visit. In a category of its own, HIFU is the newest definitive treatment for prostate cancer. It stands for high intensity frequency ultrasound and is given in 1 to 4 hours in a single outpatient procedure. This works best on condensed low-grade cancer and is not approved for Gleason 8 or more. Cryosurgery, also known as cryotherapy, is a surgical alternative that freezes prostate tissue into necrosis. Some will still undergo a radical retropubic prostatectomy rather than a robot-assisted laparoscopic prostatectomy. All treatment will cause some extent of stress incontinence and erectile dysfunction due to the sensitive location of the prostate. The treatments are listed here in order of aggressiveness. The more aggressive the treatment, the more aggressive the side effects.